Hello, my name is Mary Albert, and I'm an implementation specialist with Brown & Brown. Brown & Brown is the broker on behalf of your group. So what that means is that you do have a team put in place to support you, not only during this enrollment window, but throughout your upcoming coverage period as well. Your open enrollment will end on December 20th. So this is your time to go in and make your elections, which is going to be submitted back to your HR team on a paper form. This enrollment is active, so you do need to make the elections prior to December 20th. Once that date rolls around, you will be sealed or locked in with the benefits that you've elected during this enrollment window for the upcoming coverage period. And as you can see, your coverage period will go through the end of 2025. Now, if you want to pause this recording to take a closer look as to who is eligible for signing up for benefits, along with the eligible dependents and all the verification that you would need to submit to your HR leaders. So you might want to pause this page so that you can take a closer look. Now, I did mention that your open enrollment closes on December 20th. So once that date rolls around, you're locked in with those benefits. However, if you experience a qualifying life event, and I'll take a closer look here, we have listed some examples of what a qualifying life event is. If you get married, divorced, or if any dependent status with their benefits has changed, it's going to be real important to reach out to your HR leader within 31 days of the event to see if coverage can be changed. This page is really important because if you are signing up for medical, which is through United Healthcare, I highly recommend you creating a member portal. We have included a website here. Once you're effective on the plan, that would be when you'd want to register for this portal. How to find a replacement ID card, most importantly, how to search for an in-network provider. There's a lot of great benefits by creating a member portal. Additionally, United Healthcare does have an app listed here. I would advise if you have a smartphone to download that app so that you have all that information on the go. You do have virtual visits that you are eligible for when you sign up for medical. The great thing again, with that member portal is if you go onto your portal and type in virtual care, it's going to walk you through the steps of how to utilize that service. I would advise, if you can, doing that ahead of time so that if you're not feeling well, you won't have to figure it out then. This is a great service because you know your body best, and when it's applicable for that type of care, it's available 24 hours a day, 7 days a week, and you would be paired with a licensed health professional that even if they deem it medically necessary to write you a prescription, they'll be able to do so through that platform. United Healthcare does have a cost estimator tool, so if throughout the year you are perhaps needing a procedure or some type of special treatment, this will give you a general idea as to what that treatment or procedure may run you, along with some great built-in rewards. I encourage you to take advantage of that because as you earn points through United Healthcare, they can be redeemed for different rewards. Now, I will go over your prescription drug coverage when utilizing your medical plan, but do know that sometimes there's other alternatives. And I always say this is your skin in the game. If you do receive a prescription, how you fill and where you fill that prescription could save you money. If you're using your medical insurance, make sure you're going to an in-network pharmacy. But sometimes there are other ways to save money, for example, through GoodRx. GoodRx is a free website, and the way it works is it can offer you lower cost depending on where you have that prescription filled for medication. If you do take advantage of GoodRx, it does not track towards your insurance, so you cannot use both. Additionally, different pharmacies have different discount programs. So do know that if you do receive a prescription, there are different ways to have that prescription filled. And where you go to have care along the way is another way that can save you money. Now, I did mention that virtual care, oftentimes that could be the lowest out of your pocket. We have given examples of when that might be applicable to you, but you do know your body best. Now, when you go in network to seek care from a primary care physician, these are also another way to keep those costs out of your pocket lower. Now, if you were to seek urgent care minimally, try to go in network and also have a general idea of where those local in-network urgent cares are. Again, if you're not feeling well, you might not want to take the time to do that. And you will see a dramatic price difference, of course, when seeking care in network, along with the emergency room as well. So those are all going to be at a higher cost. And when you can stay in network, that's going to drive those costs down. Now, these are your 3 medical plans being offered to you through United Healthcare. I'm going to go ahead and zoom in here so we can take a closer look. United Healthcare is the carrier. It's going to be important to be mindful of the name of the network. So as you can see, when you're searching for care on these first 2 plans, it's NHP, whereas the third plan is a choice network. Things that are the same on all 3 plans is when you go to, I'll go ahead and hold it right there, your annual physical, that includes your annual blood work, any preventative screening that's appropriate for your age and gender, as you can see when staying in network, is going to be covered at 100%. Now, there's roughly 2 ways you'll pay for a service when you seek out medical care. I'm going to zoom out so we can look at this at a glance. As you can see, we'll use the office visit as an example. On this first plan, it's a copayment, whereas the second and third, you're paying towards your deductible. So let's go through what this looks like first. If I were to elect the second plan and have to go to a primary care physician, I'm going to stay in network, and I'm going to pay a reduced and negotiated contracted rate for that service because that provider has a contract with United Healthcare. And if I'm on this middle plan as an example, and let's say I also need urgent care, it's the same thing. When staying in network, you're going to pay that reduced and negotiated contracted rate. The money that you spend that has the words deductible plus coinsurance beside it tracks to a location, and I often refer to it as a bucket. So on this plan, I'm using the employee only as the example. That bucket can hold $2,000 of your money. Now, some folks go along their health journey throughout the calendar year and they never reach or meet their deductible, and that's fine. You'll pay that reduced and negotiated rate. If you were to hit that $2,000 employee only, imagine a wall knocking down. You then would go into coinsurance. Coinsurance is a cost sharing between you and the insurance company. So if I were to go back to the doctors, now I'm paying that, or I receive that negotiated bill, that reduced bill, I'm only responsible for 20%, whereas United Healthcare is responsible for 80%. Third phase, worst case scenario, is this out-of-pocket maximum. If you were to hit this out-of-pocket maximum, and I'm pointing to it right here, giving the example employee only, $7,500 through health covered services, those health covered services thereafter, when staying in network for the remainder of the calendar year, would be covered at 100%. Now, a lot of folks don't hit that amount, but it is good to know that that amount is put in place. So if something were to happen, there's a limit to what you're expected to pay. So looking across the board at a glance, you can see how that would vary on each one of these plans. So these plans work similarly in regards to the deductible, coinsurance, and out-of-pocket, but you can see that the out-of-pocket is different. Now, comparatively, if we jump over to this plan, you'll see the word copay. So that's the other way you may pay for a service. A copayment is a fixed flat dollar amount that you are expected to pay at the time of service. Oftentimes I say, imagine it like a ticket. It's a ticket that you pay to go back to see the doctor. So some people like copayment plans because they know exactly what they're going to pay. So as you can see right here, if you go to the office primary care doctor or a specialist, it's a flat copay. Now, when you make a copayment, it does not track towards your deductible. So you might ask, where does it go? It's going to drop into that bucket that matters, that out-of-pocket maximum bucket. So you can see that amount is different on this first plan. This is great to know. Virtual visits are $0. Now, hospital services are going to work similarly for that inpatient admission, for that deductible plus coinsurance. And then these, of course, are flat copays. Like I mentioned earlier, you do have prescription drug coverage on all three plans. I do want to mention that if you are on the second or third plan, the way it works is if you were to pick up a prescription and use your health insurance, that as well is you're paying that negotiated rate for that prescription. It's all tracking towards your deductible. And if you hit your deductible up here for medical services, you're paying 20% of your bill. Whereas if you meet the same deductible, it's combined, you would drop into a flat copayment when picking that prescription up. The first plan, you do not have to meet or hit your deductible. So there are some differences there. Now talk to your doctor. Oftentimes generic does drive that cost down, as well as getting something written in a 90-day supply. Now I mentioned the importance of staying in network because you do not have coverage when stepping out of the above networks. Now you do have dental coverage on, I should say, being offered to you. And this is one of the things that is changing for this upcoming year. I'm going to go ahead and look through my notes because before you had United Healthcare, I'm sorry, before you had Humana and you are switching to United Healthcare. So do know the carrier is switching not only for dental, but also for vision. Go ahead and take a closer look so that we can see the two plans being offered to you and what those differences are. So specifically, the name of the network is listed up here. So that's where you really want to search for those in-network dentists. You do have in and out of network coverage, but when you stay in network, those dentists have to offer you that reduced rate. So you will maximize this plan and you'll stretch that benefit more when staying in network. So on both plans here, a $1,000 is set aside to pay the allowable charges for your dental care throughout the year. That money always does replenish at the beginning of the new coverage period, as well as that amount is set aside for each member on the plan. So if you and your children are on this plan, each one of you would have that amount set aside to pay those allowable dental charges. As you can see, if you were to seek out preventative care, it's going to cover it at 100%. If you need basic procedure, you are going to pay a one-time dental deductible, one time meaning once in that year, and you can see it's listed here. And then the plan covers you at a certain percentage. Major procedures also, once you pay that same dental deductible, will cover you at a certain percentage. So that above amount is what is being utilized in order to make those payments. So it's a cost sharing. Out of network, I did mention you will have coverage, but it's going to be reflective of the in-network rates. So if an out-of-network dentist charges more, it's only going to cover you at a percentage of the in-network rates. Now, the other thing that's changing from Humana to United Healthcare is your vision. So we have included a website here so you can search for that in-network eye doctor. And here's a fun, did you know? Did you know that when you have your eyes examined, they can tell more about your overall health than just your vision? They can see if you're pre-diabetic, high cholesterol, high blood pressure, certain heart disease, autoimmune disorders. So I don't earn commission, so I can always share, I do think there's a tremendous benefit to having your eyes examined. And when you go in for that comprehensive eye exam, as you can see in network, it's a flat $10 copay. You can get an eye exam every 12 months. So when you use the benefit is when it starts to track. It's very straightforward when staying in network in regards to if you need basic lenses, you make a flat copay. Frames, they give you an allowance to shop, as well as contacts. Now, do be mindful if you wear contacts and eyeglasses, you cannot use that benefit both in the same year. And that's the way vision coverage works. So you'd want to alternate, perhaps using your benefit for frames one year and then for contacts the following year. Now, if you are at a facility and they're giving you all these coupons and discounts, and that sounds great, chances are you are out of your network. And that sounds great, but oftentimes that cost is going to be much higher. So to drive those costs down, maximizing your benefits, not only do you want to have that eye exam, you also want to get those materials filled in network. And this is an overview. You can pause this recording so you can take a closer look as to the premiums per paycheck. This page just includes some great terminology that you heard me referencing today. So if you want to go back and take a deeper look, you can do so. Also, some examples of how that works. More definitions here. And we are at the end here, so I want to review some important dates. Make sure that you are electing benefits if you want coverage this year because it is an active enrollment. You will have until December 20th to make those elections, fill your paperwork out, and make sure you've submitted it back to your HR team prior to that date. Thank you so much and have a great day.